Okay, so good evening. Thank you, Sharon, and thank you to Fertility Network UK for having Now Fertility tonight at this webinar. I'm joined by Alessandra Ripanelli. She's a senior fertility nurse with a decade experience in dealing with fertile and subfertile patients embarking on assisted conception. We at Now Fertility have decided to change the way fertility care is delivered. We aim to make it more patient-friendly, less stressful, more accessible and affordable. We appreciate that fertility care is not always delivered at the point where our patients live or work. And for different reasons, personal, maybe linked with the needs for a specific type of treatment, as well as financial, sometimes patients opt to undergo treatment outside the country where they live. And Now Fertility is made by a team of consultants, nurses, and care coordinators, and we work together collaboratively to ensure that the journey is as seamless as possible, as swiftly as possible, and certainly as stress-free as possible. I know that some of you may have experienced treatment outside the United Kingdom. Some of you may be considering treatment outside the United Kingdom. And my role and Alessandra's role tonight is to answer your questions and also to give you a degree of reassurance that treatment outside the United Kingdom, if done or pursued within centers that have the same standards, the same quality measures as in the UK, will certainly be a positive experience for you. Before I go into the details of how treatment overseas can be seen, I'd just like to present perhaps a number of cases where treatment overseas is considered. We have patients from the Middle East that decide to pursue treatment in Europe for non or non-donation. We have patients from Europe decide to pursue treatment in the Middle East for specific options that are not available in Europe, such as sex selection for medical or non-medical reasons. We have families that are considering treatment with a non-donor that decide to come to the UK because that is what is allowed in the country. But there are also instances when couples or individuals decide to pursue treatment overseas for financial reasons. And some of you, or most of you, have become aware in the recent days about a number of articles published in the media regarding the cost of living rising in the UK and the impact that that may have on self-pay IVF treatment. So there are various scenarios when fertility treatment is considered overseas. And we as healthcare professionals and patients organizations like Fertility Network UK have the duty to ensure that patients like yourself are well treated and receive the care within the facilities that are certainly licensed, but also to some extent quality controlled. And that is the place of Now Fertility. We are independent. We are the link between the patients and the partner centers we work with. And we have partner centers across Europe, as well as the Middle East, North Africa, and the US. But we also want to be sure that we are not leaving the patient's experience to their own, or certainly in a dialogue with the center where the patient is going to have treatment. Hence why our consultants and nurses and care coordinators take pride and take the responsibility to link the patient's demand, patient's request, patient's needs and preferences with the best clinic we have within our network. We appreciate it's stressful. We appreciate that sometimes it's confusing, and we appreciate that it may have an impact on family life as well as work life. So collaboratively, we inform our patients of the options. Collaboratively, we take care of the treatment from day one until patients arrive at the center where the treatment is carried out. Some of you may wonder what is the role of a fertility nurse, and Alessandra will discuss that in details, because certainly is an important one, managing patients' care remotely. But we have introduced all the tools to ensure that the dialogue between our patients, our doctors, our care coordinators, and our clinics is second to none. We are mindful of privacy, of confidential information, as well as of the prompt communication that patients require. So for that specific reason, we have also introduced a virtual phone line, which enables our patients to communicate with our nurses and care coordinator at all the times, ensuring that the support they need is always one phone call away. So that is my brief introduction. I'm sure that Alessandra will have the opportunity to discuss the role of the nurse when patients decide to embark on treatment overseas, as part of the questions you will be posing to us. So, Sharon, I hope that the few minutes introduction was good, clear, and we can now open the, I think, the floor to questions.
Okay, thank you. So I'll just start with the questions I've got. So one of the questions that has been raised with ourselves is, how do patients ensure when they travel overseas for treatment that they're going to get treatment to a same standard or better than they would get in the UK?
When patients travel outside the UK, and they travel outside the UK with Now Fertility, in any of our overseas clinics, Greece, Egypt, Poland, Saudi Arabia, Spain, Tunisia, Turkey, USA, and also soon UAE, patients can be reassured that the clinics have been quality controlled by us. And that means we have screened the clinics. We have requested the clinics to submit the latest data, success rate, as well as all the regulatory requirements the clinics need to have in the country where they operate. We also ensure that all the clinics we work with have quality measures in place and have accreditations. So we are not going to refer patients to clinics that we've not vetted, we've not checked, we've not screened. We have systems in place for compliance, as well as we have in post a relationship manager that actually manage the relationship between Now Fertility and the centers, to ensure that all the information is always up to date, all the data are collected, and on a regular basis success rate submitted by the clinic or the clinics to us. So we are very, very confident that the care patients receive when traveling to any of the clinics within our network is exactly the same as what they would expect at home.
So what would be the benefit to a patient to use a clinic overseas as opposed to a clinic in the UK? The quality of care in the UK, I think, is one of the best in the world.
The clinics, thanks to the regulator, they have to follow certain standards and measures that really pose no or very, very little risk to the provision of service. Clinics, however, are not able to offer the full range of treatment, some of which may be a choice for the patient. So, for instance, donation with an unknown sperm donor or egg donor. Just that is one of many examples, as well as financial reasons. Treatment overseas in our clinics in Tunisia, in Egypt, is about 1/3 of the cost of the UK. So there are some medical reasons, there are some clinical indications, of course, as well as there are some financial reasons why treatment may need or patients may wish to pursue outside the United Kingdom.
Okay, so if I'm a UK patient and I'm considering going overseas because the clinic I've been offered has got the treatment that I'm seeking and it's within a price range that I can afford, how much time would I have to spend in that destination country? How many trips would I need to make?
Very, very little. Thanks to our system of satellite clinics also in the country or countries where our patients come from, and we have in our patient population a network of patients coming from more than 60 countries. So thanks to the satellite clinics and thanks to the collaborative approach with our partners, IVF clinics, patients being in the UK or overseas, they only need to spend no more than a week in the country where they're undergoing treatment. All the ultrasound scans, the blood tests can be carried out in the UK or in the country where the patient lives or works. All the consultations with the consultants are done via Zoom. All the appointments with the nurses are again done remotely or via telephone using the virtual phone line we have implemented. All the admin support is done remotely. All the counseling, that being support counseling, implications counseling, as well as genetic counseling, is done online as well. So we are a hybrid solution for patients. We combine the online technology with telecommunication as well as in-clinic presence only for what is essential. So patients normally will be traveling to the country where the treatment is carried out just for their collection. If they decide to have a embryo transfer, there is need to have a fresh embryo transfer, then we'll have an embryo transfer 5 days later, and they stay for no more than 7 days. We have had patients traveling to a specific clinic only for a couple of days, if that was an egg freezing cycle or a frozen embryo transfer cycle. So really, the time they spend overseas is very limited.
So how, as a UK patient, would I choose which country I should seek treatment in? Do you help guide that? Or is that a choice I make because of the logistics? Like, I would prefer to be, 2-hour, 3-hour plane ride as opposed to a 5-hour plane ride.
Of course. So we have a process in place, and it's similar to a triage pathway. So whenever a patient approaches us first of all, we arrange a 15 minutes free of charge consultation with one of the nurses and one of the care coordinators, just to understand what are the needs and the preferences of the patients. We ask the patient in advance of that appointment to give a preference of their language. We can cover several languages within our network, so they will tell us what language they prefer to speak. They then will match them with a care coordinator and a nurse, and they will have an appointment to discuss the requirements, needs, and preferences. At that stage, they may have a number of options. May have an option to go to the US, to go to Egypt, and to go to Saudi Arabia. Or may have an option to go to Greece and go to Spain. And once we have identified, based on the clinical needs and preferences, the countries where they can go, then the second step comes down to the distance, how far is traveling to Saudi Arabia as compared to traveling to the US. And the third is the cost. So it's very simple. We guide the patients, we support the patients, we inform the patients, and we then work with the patients from day one until they come back from the clinic. So we're not giving the options and then leaving patients to make an informed decision. We work together to ensure that there is no question that remains unanswered.
Okay, thank you. I'm going to start just working through some of the questions because some of the ones I've been sent are similar to the ones that have been asked in the Q&A. Firstly, you did say that you've got satellite clinics. Are they across the UK? Are they focused in London? Do you know if we've got people from Scotland, would they have to travel to London, or do you have satellite clinics across the UK?
Yeah, we have a network of satellite clinics, and we onboard satellite clinics all the time. Our nurses and care coordinators work with the satellite clinics to ensure that patients can have appointment at a convenient time. And also, satellite clinics are near where they live or they work. It may be that a patient has an appointment at a satellite clinic in Glasgow, if she lives in Glasgow, but she may work in London, and she will have another appointment with a different clinic in London. So indeed, we have a network of clinics that we have already onboarded and that we explore during the patient treatment in Northern Ireland, in Scotland, in northeast and northwest of the UK, of England, in the south, in London. Yeah. We don't have, actually, we don't have a geographical area where we do not have a clinic or we have experienced difficulty in referring a patient for an ultrasound scan or a blood test.
Okay, thank you. So, Now Fertility has been going for nearly 2 years now.
Yeah.
Do you have feedback from UK patients that have been through the, treatment process with Now using a clinic overseas? Is that on your website?
Yeah. We have feedback on our website. We have written feedback that patients send to us without posting it, without putting it on Google, or without putting on our website. But we have indeed a very, very positive experience. The one actually comes to my mind that I have here with me is one from a patient actually had to travel from the northwest of England to Egypt, and feedback, which is available on our website, reads, "I would highly recommend Now Fertility, which is going to have anyone who's going for IVF and gender selection. Everyone in the team is very supportive." And I think the most important part of this feedback is the best thing is Now Fertility saved our time. So rather than spending 21 days abroad, we only went for 8 days. and it was for egg collection and embryo transfer. So this is an example how treatment can be facilitated, but this is across a wide range of treatment options.
Okay, thank you.
And I think Sharon, what I would like, please allow me to say, is actually to explain in instances when patients are, say, based in Scotland and they're traveling to Greece. How are they supported? Because this is the most important thing. And I would like to perhaps ask Alessandra to explain from a nurse's perspective how the nurses support the patients throughout the journey, because we have a very robust system in place to ensure patients are shown how to do the medications, are explained the protocol, and also we benefit from our own online pharmacy, which enables patients to receive the medications at home without having to source the medications themselves. So, Alessandra, perhaps you can just chip in and explain that.
Yeah, of course. So from the start of the journey, our role of fertility nurse is to guide the patient throughout each step of the treatment, providing all the support they need by virtual consultation, phone or emails, and of course, providing practical information that they need. For this reason, we normally organize 1 hour consultation to go through the treatment plan before the stimulation starts, and also about the injection teaching, or talking about side effects, and also information about lifestyle, including exercise, diet, everything. Because we are aware that the stimulation with the use of injection can bring anxiety and stress. For this reason, normally what we do, we propose to our patient to have the first injection together virtually, and if needed, also for the next few days until they feel comfortable to do so by themselves. On the first day of the first injection, we set up a video call where basically the patient prepares the injection while I will talk through it, the preparation, and then the patient will inject the medication in my presence. So normally in this way, they feel more comfortable. And also, we do together what is important, a trigger injection, because this needs to be done on a specific time, specific day, and brings a lot of anxiety. And the patient really like this very much. And this is a plus because in a physical clinic, this won't be possible because normally these injections are done in the evening where normally the clinic are closed. So this is something that the patient likes very much because it's, of course, makes the process normally smoother and stress-free. So this is very important for the patient.
So can I ask another question to both of you? What happens if there's a medical complication where that patient is overseas in relation to the fertility treatment? So I'm thinking ovarian hyperstimulation, something like that, and it's identified and they're in another country. Who then treats that patient? Are they covered by now? Is there insurance? Do you know what happens with those patients?
Very good, very good. Thank you, Sharon. This is a question that is often asked by patients coming to us. And our links and our partnership scheme with individual clinics includes the service that they would or they should provide to patients that may face a complication in relation to an egg collection, for instance. So if the patient that travels to one of the clinics that is part of Now Fertility network faces or is the subject of a complication, then she will be looked after by the clinic where she's undergoing treatment exactly the same as if she was a patient in that clinic overall.
Okay, thank you. Somebody's asked here in the Q&A, the payment breakdown on fertility treatment can be really confusing for patients. It's not always clear what elements are required in an individual treatment journey. Does Now fertility? Is the payment plan clear? Is the patient advised at the very outset of all the potential costs that they will face? Do you know, what does this look like to patients? Is that information on your website, or do they need to have an initial consultation to get total and final costs?
Again, this is something that makes Now Fertility different from most IVF clinics worldwide. We are very transparent, and we are an all-inclusive service, which means patients will pay an amount for the IVF cycle, and that will include the treatment, that will include all the ultrasound scans and the blood tests they need during the course of the treatment cycle. That will include all the consultations with the consultant prior to starting treatment, as well as post-treatment. And that will include the counseling. So patients will only have to pay for the medications. And again, using our online pharmacy, there is a reduction in cost of about 20%, 25% compared to high street pharmacies. We provide our patients at the very, very outset with 2 documents. One is a consent form, and the other one is an ICP, which stands for Individualized Cost Plan. And that is our promise to patients, that they will not pay anything more than what they're actually being offered at the outset. So patient will know exactly the amount, and there are no hidden costs. In the ICP, there is a description of the services that they're accessing, and they know exactly by the time they start and at completion what they've paid for.
Okay, thank you. Moving on, you covered another question. So all the counselling, like implications counselling, that's all part of the package?
Correct, yes. All the counseling. Counseling is part of the package. If patients do not need counseling or do not want counseling, we offer as an alternative to counseling also fertility coaching. So they can have a support counseling session with a qualified counselor. We have, I think in the UK, we have 3 or 4 counselors in our panel, or they can have an appointment with a fertility coach.
And is the fertility coach at a cost, or is that part of it?
No, it's part of the package. There's no additional cost.
Okay, thank you. Does Now Fertility track the pregnancy rate, and have you got pregnancies amongst the people that are using your services?
Of course, yes. We have many pregnancies, and we do track pregnancy rates. And as I mentioned at the very beginning, our endeavor is to ensure that all our partner clinics submit the pregnancy rates, because we want to be sure that we're offering our patients the very best. So we have our own way to track pregnancy rates, and we also ensure that clinics are compliant with producing and submitting their own data.
Okay, is that one of the criteria for the clinics that you use, that they've got, do you know, average or above average success rates?
Yes, actually the main criteria are, one, that they have quality measures in place, 2, that have a clinical pregnancy rate above national average, and 3rd, that they allow us to have access to the pregnancy rates. So these are very, very important.
Okay. On the same subject, we've had somebody else asking, is there any way possible that any of your current or former patients would share their personal experience with a prospective patient?
I think I'm not entirely sure if anything beyond a feedback review can be done. We are not in a position to ask a patient to speak to another patient. Doesn't matter how anonymous can be, but there will still be an exchange of identifying information. If that is the name on a Zoom account, if that is a name on Teams, that is a phone number, I don't think is practical. We have on our website many testimonials provided by patients. We have Google reviews. We have many feedbacks have not been included on our website in the testimonial section, because patients have just written a personal note to us rather than a testimonial for the website. So I'm afraid in this day and age, putting a patient in contact with another patient, I think is not possible. Okay. Outside the scope of a patient organization like Fertility Network UK, of course.
Okay, thank you. Someone's kind of added on to the previous question. Do you have the live birth rates for each country? So yes. In addition to the pregnancy rates, and do you have then that clinic's evidence to support that they're above, they're on or above the national average for their country?
Of course, yes. We have the clinics don't have to tell us our clinical pregnancy rate is 50%. The clinics have to provide evidence through their own quality manager or quality reporting system of the success rate. And the success rate is not just the clinical pregnancy rate or the live birth rate. The success rate is also the fertilization rate, the blastocyst formation rate, the survival of blastocyst at the time of thawing. So we ask for specific outcomes that precede the establishment of pregnancy. With regard to live birth rates, not all clinics, not all countries require the live birth rate reporting. So the clinics where the live birth rate is reported, because it's mandatory in the country, we ask for that information to be made available to us.
Okay, thank you. Someone else is asking, is there certain countries that have got different systems in relation to parental rights and restrictions regarding donor gametes?
I think that I can say, Sharon, on behalf of Now Fertility, that we offer most of fertility treatments. We also know that there are significant differences in legislation between countries. We have recently expanded our provision of services and started a partnership with a law firm to ensure that our patients can also benefit from legal advice as and when needed. Now, they may request legal advice in a specific country or for a specific treatment that our law firm is not able to provide. In that case, our law firm will find within their books another law firm that can assist our patients. So there are differences between countries. We will never start the patient on treatment without being absolutely certain that what they're asking for is legal and also obviously compliant with the regulations in the country.
Okay, thank you. For embryo freezing, how does one select donor sperm? I'm not sure if that question's two questions. So if you're using donor sperm, what's the selection process?
Okay, perhaps I can leave Alessandra to talk about, because actually we have different selection processes for donor eggs, donor sperm, and donor embryos. And so I leave Alessandra to perhaps talk about the selection of donor gametes and donor
in
embryos.
general. Yeah. So depending really where the patient wants to have the treatment, so we can advise on different banks that we work with. So for example, for one of the bank we work with in Cyprus, this is for egg oocytes, for eggs. We able to do the matching. So we'll normally advise the couple of the patients to complete a characteristic form where basically the patient can put all the characteristics themselves and also characteristics that they wish to have for desired donor. And based on the characteristic, and also we ask for the pictures of them, and we try to do the matching on the bank. On the catalog, we basically can see all the donors' profiles together with the pictures. Patient not able to see the pictures because it's not legal in Europe, but as a professional, we can see them as adults and also as a child. So we can create the perfect matching for them. Then we offer 1, 2, or more profiles to the patient. And then when they decided which one would try to go for, we reserve this, and then we ship the gametes to the clinic where they wish to have the treatment. So the process is very, very quick, immediate. Normally the banks are full of donors, and we can offer also different banks. If, for example, that bank is not doesn't include, the donor, the characteristic that I prefer. So it's a very easy process. We normally have few consultations with the patient, so we discuss together the profiles. We can advise which one is best. Also, we need to match the blood group. This is quite important. We need to have the blood group before in order to do the matching, but it's a very easy and smooth process.
Okay. Here in the UK, because we've got the known donor, I take it you do use banks where the patients can get access to known donors?
Yes, of course. We, I think depending, as we were discussing earlier, depending on the patient's preferences, we can advise them to have a treatment in the UK, obviously with a known sperm or egg bank, or overseas. We work overseas with Spain, where we predominantly do fresh egg donation. We also have a partnership with an egg bank in Cyprus, and we export eggs from Cyprus to Poland and Greece. That obviously would be for known donors. We work with a selection of sperm banks, but patients can also choose their own bank, and we facilitate the treatment with the chosen gametes. So we assist according to their needs and preferences. Okay,
thank you. You might have touched on this, but just for extra clarity, so if one of the partners has no biological relationship to the child, and this would also go for people that are seeking embryo donation, will they have legal parental rights, or do they need to go through courts in the country abroad or courts in the UK? How does a patient navigate this whole journey in relation to getting legal parental rights?
Okay, so we work and operate embryo donation from Poland as well as from Spain. In both countries, there is no need for an order. There's no need for legal parental responsibility being granted by the court to the couple or to the individual. The reason why we work with two countries is because in Poland, only couples, married or unmarried, can access embryo donation. Whereas in Spain, single women can access embryo donation. So we try to make it as easy as possible. And if there is a need to get legal advice, of course, we can, as mentioned earlier, direct our patients to access that sort of kind of expert information. But we are pretty confident that the services we offer at the outset are not going to create a level of complexity when they get back home.
Okay, thank you. Once patients are overseas for the treatment, does Now Fertility continue that support? Maybe this is one for Alessandra, or are they then supported by the clinic?
So we are the team. So basically from the start of the journey, the patient will have a fertility consultant, female fertility nurse, and a fertility coordinator. And this will be the team until the end of the treatment. So we'll follow the patient all the way through, even when they will be in the actual overseas clinic. We are the main contact. So we make sure that the patient arrives, that the patient is fine. We always in contact with the clinic to make sure that everything is going well. But we will be the main point of contact for the patient all the way through.
Okay, thank you. Can I ask what happens if a patient develops side effects during the treatment cycle? So they maybe not even left the UK at this point.
Yeah. So during the stimulation, the first points to make is that the side effects are very mild. So normally what will happen during the stimulation, the patient might develop pelvic cramping similar to menstrual cycle, or pelvic pain, lower back pain, or bloating, pressure on the bladder. This is the maximum that patient can have, which is treatable with a simple paracetamol, or most of the patients don't experience any of this. So side effects on the stimulation process is very rare. Of course, if any side effects happen, of course, the consultant is always available to review this. So we can quickly set up a video call, a phone call, to find out what happened and to fix the problem, of course.
Okay, thank you. I've got a single woman here who's interested in selecting donor sperm for embryo freezing. What is the process for gender selection for that embryo, if they were considering gender selection?
That's unfortunately not possible, except if the patient decides to go to the US. Because in the Middle East, gender selection or sex selection should be rather than gender, because we cannot select the gender, we can select the sex. But sex selection is possible, but donation is not possible. So patients in Europe that wish to have sex selection, they can travel to Saudi Arabia, Egypt, or UAE, but they will not be able to access treatment using donor gametes, sperm or eggs, and indeed they cannot access treatment as single women. They have to be in a relationship.
Okay.
The same case as I was for USA, so for Poland and Spain. However, we have a partner clinic in San Antonio in Texas, where instead sex selection is possible in the US, and also donor gametes. So if one of our patients single wish to have sex selection, and being single, she requires donor sperm, then the only option will be to come to Now Fertility, benefit from the support we offer and the guidance we can give while she's at home, and then travel to the US for the egg collection, fertilization, embryo testing, and then embryo transfer. And we have had these cases obviously before, and we know that it works, and we know that patients are satisfied with the service they receive.
Okay, thank you. You mentioned gender and sex. I take it that's you know, new terminology that we now refer to as sex selection as opposed to gender selection?
Yes, yes. I think there's been lots of media, public, as well as law debate about what is the difference between the sex and the gender. So we can select the sex of an embryo, but the gender is defined by the individual over time. So we could have we could have a sex. We can have an embryo that is male, but that embryo, if implants and becomes a fetus, and when this fetus becomes an adult, it can choose a gender different than the sex.
Okay, thanks very much. Someone mentioned earlier about wishing to select their own donor via yourselves. Is there extra fees if they're allowed to select their own donor?
No, there's no extra fees. If a patient, a couple, they prefer to use their own donor sperm, their own donor eggs, they have a non-donor, there's no extra fee. The only fee that they will be paying is if they have, for instance, a non-donor, they will be paying 2 fees, one for a fresh cycle for the donor, because that donor requires the extraction of the eggs and fertilization, and then the equivalent of a frozen embryo transfer cycle for the recipient receiving the embryos created with donor eggs. But if there is instead the need to use donor sperm only, is exactly the same fee as an IVF cycle.
Okay, thank you. Somebody's mentioned here an IVF refund guarantee program. I'm not sure, is that something Now does?
Yes. We have various services. We offer various services within Now Fertility in different countries. But for instance, in the UK, as well as in other countries in other clinics within countries we work with, we have a refund guarantee program. Depending on the characteristics of the patient, depending on the criteria, depending on the prognosis, they can receive up to 100% of money back if not pregnant after 3 fresh cycles, and all the frozen cycles that have been generated from the 3 fresh cycles. So let's just give you an example. For a couple that decides to travel to our partner clinic in Tunisia, they will pay more or less the equivalent of 10,000 euros for 3 fresh IVF cycles and all the frozen cycles that are generated from the 3 fresh cycles. They cannot start a second fresh cycle until they have used all the frozen cycles from the first cycle, and the same, they cannot access the 3rd fresh cycle until they've used all the embryos generated from the 2nd cycle. But if at the end of the 3 fresh cycles and having used all the frozen cycles, they are not successful with a live birth, not with a positive pregnancy test, with a live birth, then they will get 10,000 euros back. So we do offer a refund guarantee scheme, which is based on live birth, not on positive pregnancy test, not on clinical pregnancy test, clinical pregnancy. But our patients have to meet certain criteria to access the refund guarantee program. But that is available in all the clinics, but is not available for sex selection.
If a patient goes into a refund guarantee program and have an unsuccessful first round, would the patient be allowed to try again using their own eggs, or would be they?
Yes, of course. Yes. Yes, of course. Yes, absolutely. They can do that again. We have different schemes in different countries and different regions. So in Europe, and as I say, it's also available for patients that wish to access treatment in North Africa and in the Middle East, such as Saudi Arabia and Egypt. We have the refund guarantee program, which is a very, very favorable, especially when we look at countries like Tunisia and Egypt, where the treatment is very affordable compared to the UK. But in the UAE, we have a credit facility where via our website, patients can access a high street bank, and within a few minutes they can get a loan to pay for the IVF treatment with no interest. So in countries where the refund guarantee program is not available, we have the credit facility to make sure that patients, again, they embark on the journey with no financial problems, with no stress, and they're not going to postpone the treatment because of the cost.
Is there an age limit for the refund guarantee?
There is, yes and no. Just why? Because depending on the age of the patient, may not be able to access 100% of the refund, maybe 50% of the refund.
Okay.
But if the patient decides not to go ahead with their own eggs and decides to use donor eggs, then may access 100% of the refund.
Okay, thank you. And I suppose that's individual, and that's something that patients should have an individual conversation about.
Yeah, but I think Sharon, that I think speaks volume for the confidence we have in our service and in our clinics. Because when we offer patients 100% money back, that means we are confident that the success is high. We will not be doing that unless we know that the clinic performs well.
Absolutely. And I've had multiple conversations with multiple patients. These refund schemes, because there's lots of them around, they're basically an insurance product. And I insurance companies do make money because, that they can calculate, risk, and that's what they're putting into this.